10, 6 and 4. It's nourishing the kidneys. It's nourishing the pre-heaven chi with the post-heaven chi. It's stimulating the spleen chi as well. I don't use tubes. If you use tubes, that's fine. Sometimes I roll them in. Is that okay?
Mm-hmm.
Sometimes I press them in. So as I said, I'm going to needle either side of the scar. Is that okay?
Mm-hmm.
As you can see, I got quite superficial initially.
So you always needle heaven man earth before you start off?
This is bringing chi home. Yeah. Is that what you call it, heaven man?
Heaven man earth, yeah.
I'd avoid that with this because that's your depth.
Right.
So bringing chi home. Occasionally, Ren 4 can be uncomfortable.
Mm-hmm.
And if you do hit a stinger, a pinch, it can be just that you've hit a capillary or a nerve, a sensory cell.
So it's 12,
Is that
10,
okay?
Mm-hmm.
6 and 4 and still 25.
Yeah. Now I'm going to use the kidney meridian. Now, because I'm above where the scar is, the kidney meridian should still be where it was originally. And I'm going to use the kidney meridian to move chi through the opposite arm. So this is the shoulder point. I'm just going to check. So where does your pain go as far as, is it up to here or does it go just to kind of,
Just about there.
it's kind of Sanjiao
Yeah.
14 and a half.
My stomach's going crazy.
It's because you're on TV.
Why are your needles falling downwards? Because if you're doing it, they would normally stand up, wouldn't they?
I'll show you now. Because I put them in superficial to start with and then I'll come back and fix them.
Right.
Actually, and one of the things, well, there's a few benefits to needling without tubes. You get an idea of what's going on underneath the skin. Sometimes when you're using the finger to do the needling, you'll feel subtleties underneath as well.
What's the concept behind the original opening of the needle points where you've done 12, 10, 6, 4 and 25? What's the concept behind that?
Because it's nourishing the pre-heaven and post-heaven chi.
Okay, so that's where it's...
And it's kind of preparing the area for subsequent needles as well. Now, you might notice that I'm just gently moving down the handle of the needle. I'm going probably just about 0.6 on. With these lower points, I'm probably going to go a little bit deeper. The needles should be perpendicular for the main. They'll be perpendicular. Now I'm going to go a little bit deeper with the kidney points, or sorry, this is Ren 4, which is very stimulating for the kidney chi. Okay, so now we're getting into more fine tuning. I've fixed the kind of the scaffolding points or the main acupuncture points. Now this is where the fun starts. So you're trying to fix a problem between, it's about here, so I'm probably going to find an ashi point This is the shoulder and this is the elbow. I'm probably going to find something around here.
So on normal superficial palpation, that should kick up.
Should often, yeah.
If,
Often you do, sometimes you don't.
if the point of origin of the pain is not on the shoulder, would it be presenting like this, where you're palpating and you're not finding anything, or will it always?
It'll usually be where the pain is experienced as well.
Right.
But funny, I was treating a woman in Dublin there on the course I did, and she had a chronic shoulder problem. And I did experience like a cotton bud sticking up through her abdomen. It was like that, which I don't often experience. And I automatically jumped on that and thought that's going to be the one that's going to make all the difference. But it made partial difference, but it turned out that it was more around this area, actually. Funny enough, here's a little point here. So I'm gonna see what result we're getting with that. How's the shoulder, elbow discomfort at the moment?
There's definitely something moving.
Can you feel it travelling down your arm?
Here, yeah.
Okay.
I can.
Cool.
It's like a trickle.
Yeah.
The fingers have gone a bit, not numb, but a bit tingly.
Cool.
But there's some heat down here.
Deadly. So if you were to, right, she is moving. We've opened the gate. She is moving down the opposite lane. If you were to score the pain or discomfort, what's it at now?
It feels quite comfortable not moving it around too much, but if it was an 8, it's probably about a 4.
So if it was a 10, it'd be a 5.
Yeah.
This is where, you're,
Yeah.
okay, that was an easy mathematical one.
Mhm.
It's
Yeah.
50% improvement. That's not bad. Okay, I mean, haven't really refined it, but it's important, sometimes you get complicated cases and they've pains in lots of different areas, and if you start going, yeah, maybe cut it there.